Well, thank you very much. Thank you for having me today. So today I'm going to be presenting on this first introduction session hosted by the Global Health Informatics program at the Children's Hospital of Philadelphia. And yeah, we'll be talking today about global health informatics. I'll be sharing from an African perspective, mostly making reference from the African continent perspective in terms of why global health informatics is really important, and particularly why it's critical right now to advancing healthy lives for all. And sort of give a bit of perspective of what's going on the continent as we sort of get into this four-part series. So by way of introduction, my name is Stephen Wanyee. I've got a background in computer science, software engineering, and health informatics. Currently run my own company, which is more of a social enterprise where we've been building software solutions for the health sector for the last 15 years. We're based out of Nairobi in Kenya. I'm also a founder member and currently serving as the Secretary General of the Kenya Health Informatics Association and also the President-elect of Health Informatics in Africa, otherwise known as HELINA. And I'm also quite active in a lot of global health informatics and digital health communities, sitting on the boards of OpenMRS, OpenHIE, Health Data Collaboratives, Global Goods Community, and many others. And I'm currently working through my PhD in information science, systems, and health informatics. And my primary focus is decision support. So starting off, just to get a couple of alignment on definitions and understanding, I picked this out of the National Library of Medicine that defines global health informatics as a multidisciplinary field that combines such methods and applications of technology with a clear focus on improving the healthcare systems and outcomes. And I also extended that definition to emphasize that this should happen. If you're talking about this from a global informatics perspective, then there's an element of collaboration, and the common method for that is really global, health informatics communities, which tend to get this sort of collaboration working out well. And the image on the right I picked out of a paper by Brian Dixon at Registries Institute that I thought brings out this really well, illustrates global health informatics really well by showing the intersection with other interventions from public health and also from population health informatics, but also tries to pull in other interventions from specializations within healthcare and medicine. So then why is it really critical for global health informatics right now to advance health lives for all? So I thought I would look at this from, from basically what the global community has defined as important for the health sectors across the world. And for that, I looked at two bodies that are fairly authoritative. So that's the United Nations and also the Africa Union. So the circle at the top left, might be familiar to most of you, is the one from the UN that shows the Sustainable Development Goals, which are 17. And goal number 3 is the one on good health and well-being. And most of you may not be familiar with the Africa Union, which is really the body that coordinates governance, collaboration, partnerships, and all that across countries in Africa, the African continent, and has a membership of 55 countries. And in 2015, they set out something very similar to the SDG, Sustainable Development Goals, that they call Agenda 2063. And it's really just a bunch of indicators, goals, ambitions, aspirations to basically improve the African continent to become a competitor at the global level, and basically make the African continent a powerhouse at the global arena. And the interesting thing is that a lot of the goals and the indicators and the focus areas between the SDG and the Agenda 2063 are very, very they're very similar. And so I attempted to put this at the bottom where you can see sort of like a fairly a line that has almost like 3 sentences. That show how the Agenda 2063 indicators and goals are aligned to the SDG ones. So there's one very specific goal under Africa Union, Agenda 2063, that focuses on health and well-nourished citizens on the African continent. And that aligns very well with the SDG one, SDG 3, which is ensure healthy lives and promote well-being for all at all ages. The reason why I bring this up is because then we, start to build the case for why it's important for global health informatics to advance healthy lives for all. So if you're to use this as your lens of looking at what's going on, what's been going on around the world, and also from my perspective, from the African perspective, then you have to look at what has been measured and how is it defined. And so the maps on the right, these are really from the SDG, basically show that that especially Africa is not doing very well. So the red shows that there are major challenges in terms of Africa achieving SDG 3, which is on good health and well-being. You can see there's a lot of red on the African continent. And then the sort of orangish color and yellow provide a better, like a better status of how other countries are doing. But Africa, we're definitely not doing very well. And so, in my opinion, I feel this is a very strong basis for answering this question. Why is global health informatics really, really critical to advance health lives for all? Because evidence shows us that we're not doing well. And from where I'm from, the African continent, we're certainly not doing well at all. And building on to why then global health informatics is relevant to address what I've just showed in the previous slide, the World Health Organization and the International Telecommunications Union, these are two member bodies of the United Nations that specifically, of course, WHO deals with focuses on healthcare, and ITU focuses on technology. A couple of years ago, they came up with these building blocks, the 7 components that they argued that if countries invest in this, this is the image on the left, the blue, that if countries invest in these ones and they do this really well, then you'll be able to layer on any global health informatics solutions or digital health, that's a popular term in implementation, in a way that will actually help improve lives and well-being. So again, going back to the previous slide where there was measurements around how we're doing health-wise and well-being-wise, globally, and also for my case, for the African continent. So the reason I bring this up is because there's been a lot of developments for this so-called enabling environment that then allows countries to invest really well, sustainably and successfully in digital health and health informatics. And I pulled out these 2 components of very important developments that the Africa Union, which basically, as I mentioned earlier, is the umbrella body that connects all the countries in Africa, 2 years ago developed policy and standards document for guiding countries on how to build up, implement, support, maintain, and effectively utilize health information exchange. And we also, most of us might also know that the World Health Organization as well launched a global strategy on digital health that runs until 2025. Now, the reason why I pull out these 2 documents is because they're really important as a part of this enabling environment to support effective implementation of health informatics solutions across the world. And these 2 really fall under this top tier of leadership and governance, where the intention from these 2 global authority bodies was to encourage countries to increase investments, build solutions that are really based on standards that are well thought out and that are then effectively and more sustainably implemented by countries. So, again, coming back from the previous slide where we definitely have a problem health-wise, and then we've got global health informatics interventions that have matured, and the environment, the enabling environment has also evolved significantly, then this really is the right time for global health informatics to step up and play its role in improving world health, basically. The other argument in terms of why global health informatics is important really to improve lives, and particularly right now, is the World Health Organization, WHO, has also been investing quite intensely in providing quality evidence for why digital health, which is a term, again, as I mentioned, they like using a lot, is really not just a nice to have anymore, but there's a lot of scientific evidence to show that it's critically important to be included in the arsenal of interventions to address public health concerns. And so there's this notion of digital health as an intervention. And the idea here, or the question has always been for a long time, does health informatics solutions, technology in healthcare, digital health, e-health, whichever term you'd like to use, does it really help? And if it does, do we know enough to know how it actually helps? So is there a relationship, whether causal or associative? And so trying to answer that question, WHO, working with different organizations and its member states, it has about 193 member states now, came up with this notion of digital health as an intervention. And the definition of digital health as an intervention is really going to the to the most atomic definition of what exactly works. So if you've got an EHR, if you've got an ML application, if you've got AI or machine learning, whatever it is, what exactly is it you're implementing? What exactly is the intervention, and who is it affecting and how? So one of the things that and as part of that process, one of the things that we did was define health system challenges, which is really this column here. What are the common health system challenges that are addressed, particularly in low to middle income countries? And then what digital health intervention needs to be implemented, and there's evidence for that showing that it actually works. And if it's implemented effectively, it will actually address this health system challenge. And so I'll just give a quick example of, if you look at the second one, healthcare providers' poor adherence to clinical guidelines. There are lots of systems, technology systems that claim to help healthcare providers improve their adherence to clinical guidelines and theoretically then help them to make better clinical decisions that would eventually help their patients get better and all that. And so some of those systems, that utilize advanced technologies, artificial intelligence and all that, they have alerts and they provide prompts according to certain clinical guideline protocols. Some of them have checklists, they have different functionalities and all that. So this study and this effort went to the level of studying these interventions very, very critically, and then arguing how well they do or they do not help to address these healthcare, these health system challenges. So again, this is another development that wasn't there many years ago. It's only come through in the last maybe half a decade. And again, for me, this representing a lot of other developments in health informatics and digital health across the world is yet another, I think, argument as to why global health informatics is critically important and needs to be advanced now and not later. The other development that has happened over the last couple of years in the global health informatics communities is when as you know, policies and laws and regulations and all that take time. Like environment, context take time to develop those, and technology moves a lot really fast. So generally, the practice across the world has been communities come around and they develop consensus, and they call those consensus principles. So I am highlighting 3 principles here that have developed over the last less than a decade. One of them is the digital investment principles, and this came around because one of the challenges that the global health community and informatics communities has been experiencing in many countries is the fragmentation of funding, especially from donors and all that. And so the big donors, so to speak, came together, and they developed these investment principles to help them sort of pool resources and reduce the fragmentation of their funding streams, so that you don't find the same donor or multiple donors, for example, funding implementation of EHRs that are further fragmenting the health system. So there's about, I think there are 10 of them. And then below that is the principles for digital development, the 9 of them. Again, those also developed out of more than 30 years of practitioners experiencing challenges on fragmentation of systems, lack of standards, very ineffective use of open source technologies that have been proven to work, not really thinking critically about the context of implementation. So there are about 9 of them listed down there. Again, they've become a place where communities are coalescing, global health informatics communities are coalescing, and it's really become a collection of best practices of how do you do digital health, or how do you do health informatics across the world. And on the right, this is the latest principles to evolve around data, and it's around health data specifically. To ask questions around what is the real value of health data, especially in global health. And so again, communities that work around different countries across the world came together, and now there are these 8 principles that have basically been endorsed by many countries. And if all goes well, they might be endorsed as well by WHO next year, the World Health Assembly, and then they become again another consensus that helps to guide countries around the world. And then the other reason why global health informatics is really, really important right now is we've seen huge advancements in medicine over the last couple of decades. We're in the era of robotics, in the era of complementary, very intelligent, smart machines, technologies that are supporting healthcare providers, practitioners and all that, actually provide better medicine, make it more accessible, equitable, and less costlier to many people, especially in low to middle income countries. And of course, in technology, we have a lot more data now. We have smarter software. We have even hardware is getting a lot easier to build and all that. We've got a lot of consumer devices, smart devices, smartwatches, and all that. So there's a lot of this going on in terms of development in these two critical sectors that, as we know, are the bedrock of health informatics. And on the other side, of course, we've got diseases that are becoming a lot more aggressive, with COVID as the latest example. But we've got a whole history of pandemics from many hundred years ago to now that remind us that we can't really wait too long to make global health informatics work. Yeah, so in a nutshell, that's really what I wanted to share with you folks today. That this is really the time. And again, just to emphasizing the point that speaking from an African content perspective, there's a lot more advancements that I've seen over the last 10 years in terms of informatics becoming mainstream, both from a legal perspective, regulatory perspective, but also practice a lot more. A huge development of informatics communities and the collaboration of the global north, global south, becoming a lot more stronger, an exchange of ideas and solutions that actually work. Yeah, so I think I'll take a pause there, and I'm happy to answer any questions that you have. Thank you.